Hey guys, thank you so much for volunteering your time to be a provider with our IPE Acute Care Sim. I wanted to give you a quick video of an overview of what's happening, your role, the importance of you being familiar with what's going on, and just give you an opportunity to ask me questions once you've seen this before next week gets here. So the first thing I want to go over is, as the provider, we know that the provider is the backbone of the team. So what you're going to be the most important thing for you to do is to be familiar with your cases. So there may be one case in your area, such as peds and OB, or you may be in the ER with 8 or 9 cases. So you will receive a set of patients that will at some point be in your area through email. You will also receive a set of provider orders in these folders, which we'll go over in just a minute. So the importance of your role is to be familiar, know what's going to happen with the patients. You don't have to be able to come up with orders. That is all scripted, as we'll show you in the folders in just a minute. But you do need to know a little bit about each of your patients so that if you're questioned, you can respond appropriately and be ready for that information to be delivered. So this is a 6-hour unfolding sim, so it begins at 8:30 in the morning. It'll go from 8:30 to 11:30. Then we'll break for debriefing and lunch, and then we come back and go 1 to 4, and then debriefing is after that. So during that sim, these cases will unfold the whole time. So you are the driver of the time. You need to make sure that tests are ordered, orders are fulfilled before moving on to the next part of the case. All of that is laid out on your order sets as well as on the case overviews that you have on your email. So don't rush. We have 6 hours, which is a long time for a simulation. The afternoon shift will pick up wherever the morning shift ends. So it's very, very important for you to pay attention to those timelines and the time frames of when the orders can be implemented. Sometimes it will say in the afternoon or after lunch or after rounds, after AM rounds. So pay attention to those timestamps because that's very important for the flow of the simulation and the level of acuity for these students to take care of. It's all very specifically timed out. So speaking of rounds, you will be responsible for leading rounds. You are not going to be facilitating it, as in being the one talking, but you are the one that you want to prompt the students. So at an hour and a half in on each shift, so that would be 10 o'clock in the morning and 2:30 in the afternoon, we will stop the sim completely. Everything will halt, and we will have a time for grand rounds. At that time, your team that's taking care of your patient or patients will gather together to discuss the plans for the patients in your area. You will go patient by patient, bed by bed, regardless of the unit that you're in. This will allow purposeful interprofessional interaction to happen. As the provider, you want the students to lead the ground rounds, but you may have to prompt them. So you may have to look at one of them and say, okay, tell us about this patient and what would you do, or what do you feel is important for us to get accomplished in the next part of the simulation. Allow them to talk about the patient with each other, but as the provider, you're familiar enough with the cases to be able to not only refocus if they get off on a trail that we're not wanting them to go down, but also to bring out them talking. Sometimes they just need a little bit of encouragement. So the next thing is you'll need to make sure before you're handing in the next set of orders that everything on the previous set has been either completed or implemented. That will allow that timeline to stay intact a little bit better. So there's not any rush, there's not any need to try and get through all the patients, get through all the orders, because even if we get to the end of the day and not everything happens that we have written, as long as it's purposeful, meaningful learning, then that's the more important thing. This is an interprofessional sim. We are focusing on teamwork and partnership and collaboration. It's not about skills. It's not about being able to perform as an individual. It's about teamwork and prioritization and figuring out what's the priority for every one of these patients. So as the provider, just follow up with your teams, just like you would in the hospital, make sure things are getting done, and that you can facilitate things along as needed. So, to go over a couple things, I mentioned your case overviews. So, you will have a document that looks similar to this. This is Shannon's, and it's got lots of notes on it. But you'll get an email, and that'll have every patient in your area that will at some point end up there. So, they may be discharged, admitted in, they may be transferred in, they may be discharged out. So, there's a flow, and that's all written on that form. So, but at some point, you will have that patient on your unit. The next thing is that you'll have a red folder on every patient. It has the patient's name, where they begin, and where they end. So this patient comes to the ER, and he's going to be admitted to ER number 9. And then at some point, he'll get admitted to bed 2 in 1364. So that just kind of gives a flow of where the patients are. On the inside of the folder, you have 2 sides. On this side, you have an order summary. So this is taken directly off of that case summary that I just showed you. It tells you everything in states that's going to happen with the patient's orders. It also includes the timeline. So for instance, this patient is an ER new admit. So once the nurse has seen the patient, you have been consulted, and you have seen the patient, then these are the orders that you will give. We don't want you to give any orders outside of what is listed, because we have to have the results as well as the medications and all of that pre-prepared. So it's very important to stay with these orders. So once these orders are statused and completed, meaning that he has an IV, he's had an abdominal x-ray, we have those results back, these labs are back, and he's had a CT scan, then at that point you would give the orders to admit to medical surgical, and then he would be transferred to medical surgical, where these orders would then become his new admit orders. So on the other side, you have each of these order sets that are here broken out, so you can hand this to the nurse, and then they can put that on the patient's clipboard. So this folder, as well as the clipboard, will travel with the patients. Another example is a patient that's already inpatient. So you can see you have your order summary, everything that's already on the chart. So this patient is an existing patient, so these are already there. And then this state has afternoon. So that means after lunch, those orders will be placed on the clipboard, and that will be the new orders for that patient. Other than what's written, we shouldn't have any questions as far as new orders and that type of thing. If a student does have an issue or want new orders, we just encourage you to then kind of refocus them on the overview of the case. You will also have, hold on just a second, in each folder you will have a blank order form. If for some reason pharmacy, PT, one of the consulting student groups has an order that they feel is important for this patient, then you can write those orders on here. Like I said, we should not have that occur, but we do want to give you a little bit of freedom. And those things need to be already approved. So no new test, because we won't have the results already done. Occasionally we can do a medication, that type of thing. But we'll try and stick to the script as much as possible. So you will be on call. So I will have your number posted in your area, and the students will text you to call them back for a question. You do not have to be present except for rounds or emergencies. So codes, any type of just patients declining. Anytime they request your presence, then you do need to come to the bedside. So you'll need to be at the bedside for rounds. Like I said, that's an hour and a half in, or any other time that the students request your presence for the patient status. You will, your goal is to let the students figure it out and collaborate. So if they call you with a status change, then ask them what they would suggest. What does your team suggest that we do? rather than just rattling off the orders that you have. So try and get them to work together to think about the orders, and then you can redirect with the actual orders that we've scripted. There are a couple repeat patients. So you'll see on the flow chart that some patients will repeat each shift, meaning that they'll come in and then you'll say, wait, we just saw this patient in the morning. That just means that we're starting that case over. So for example, in the ER especially, we have patients that come in all 4 shifts because we want all 4 sets of students to be able to see that patient. So that's what a repeat patient is. So I think that covers everything. If you have questions, please email me. We will be sending out lots of information about scheduling and everything else coming up in the next week. But I wanted to get this information out to you as soon as possible so you can get prepared for next week. Thanks again for your time.